Welcome back. I hope you saw my message earlier about coming on at 8:30. I won't be able to come on Sunday, our new time, since I'll be moving. So thank you for making the adjustment. Today we're going to, I'm so sorry, I totally forgot to talk about my lab results. So that's what we're going to focus on in terms of our wellness segment. Of course, we're going to get into spirituality. As you can see by the title, our main topic is going to be the business side of nursing school. If you're new here, there's like a main topic and then a weekly update as it relates to my nurse practitioner entrepreneurial diary series. I go live every weekend. Oh, hold on. Sorry about that. I go live every weekend normally. And I just picked a new time, which is Sundays at 3 p.m. Eastern, right here on YouTube. So if you follow the notification bell, you'll be notified. And if I have to make an adjustment like I do this weekend, I'll just let you know in advance. So every week when I come live, we have a main topic, and then we have our agenda, which covers health and wellness. So I usually provide some kind of social media tip. Sometimes I talk about a business tip, like a business idea that you can do outside of direct patient care. I usually go over updates on what's going on with the Mahogany Dermatology blog, the virtual Preceptor shop, and any local events or upcoming conferences that I plan to attend. Okay, that's the puppy who wasn't doing anything until I hit the button to record. If you're new here, welcome. My name is Dr. Kimberly Madison. I'm a doctorally prepared nurse practitioner, and I use social media to present my life as a case study, since so much of what we need to know and understand about entrepreneurship as nurses and nurse practitioners is not taught in school. And so many of us are out here trying to do this thing. And there's even more of a trend of people coming into healthcare really motivated behind starting a business as soon as possible. And I think the question is out there. I mean, it's out there on social media. Can you start a business as a new NP? So, new NP, new time in business, and maybe even a new specialty, especially if you're coming in as brand new to the industry. But even if you're transitioning, my space is dermatology. So, there's a lot of us out here. Well, I didn't start in primary care, but for a lot of NPs do start in primary care because that's our clinical foundation, and our training is all about creating us to be primary care providers so we can fill this shortage. And so whether you're coming in and you do those, that's like your entry point or not, there's a lot of people who want to get into derm, either from primary care. There's a few coming over from psych, women's health. And, I kind of put urgent care, emergency department all under kind of that primary care lens, if you will. Because that seems to be the trend. Everyone's kind of coming from that way. There's a few other specialties that people are coming in from. And so it's a new specialty. So you still have at least some of those things are all new. And the question, particularly for those of us coming in as new providers and also wanting to start business pretty quickly, is how can we do it? Is it possible? And certainly there's people out here like Fatima Francesca, wonderful example of how it can be done. And so grateful that she continues to share that journey. I came across her videos. It's been maybe during when I was in NP school. And I was really impressed by her. And also DMP Anissa, she does aesthetics out in California. And she was wearing pink gloves. And I was just like, I want to wear pink gloves when I go to work. And so that really introduced me to the wellness space, and I haven't looked back. So yeah, let's get into it. So we always start with health and wellness because it's super important. I use this opportunity to be kind of like a virtual preceptor, not only talk about clinical practice, but also just like life outside of clinic. That's a big part of what I talk about. I was talking to a coworker of mine today, and it's like, I saw a reel on Instagram, And this NP owns a CNA school, and they were getting some testimonials from some people who had just graduated from their program. And they were saying, what were your thoughts? What do you think about it? And they were just focusing on, they were all like the hands-on procedures, the hands-on procedures. And it reminded me of in the beginning of nursing school, so many of my colleagues were just like so focused on placing a catheter. And I always know it's going to be an NP. And I knew NPs don't place IVs. It can happen, but for the most part, that's not what we're doing on a day-to-day basis. So it was never a big goal of mine. Because I worked at night, I did do a lot of them. And so I did become quite proficient. But hearing those graduates talk about procedures, seeing all the videos online that are really procedure heavy, and then remembering back at the beginning of nursing school when everybody was so focused on procedures. And man, I don't know if I certainly don't want to give you that impression that all of our practice and our contributions are wrapped up in procedures. And even when I think about my day, I'm not thinking about procedures. Certainly, if I was a surgeon, that would probably take up a lot of my thought process and preparing and planning. But when I was talking to my colleague today, who I've been orienting, it's the end of the week. It's a Friday, and we're thinking back on our week and reflecting on how it went and how we feel at the end of that week. And the last thing I'm thinking about are procedures. When people are leaving the industry or talking about being burnt out or looking for new jobs, they're not thinking about procedures, because that is not the basis of what we're here to do, or what we're doing overall. And so a lot of what the job entails impacts our mental health, our wellness, our spirituality, our finances, right? A lot of us have loans or have to consider how we're going to pay for school. So money is a big part of that. And so we talk about that. That's what I use this for. So we always start off with wellness, and then we get into our agenda, and I'm switching things up. So we'll do spirituality. We have a devotional to read. And then we'll talk about the main topic. And then for those of you who like the weekly update and want to hear about those, then you can stick around after that. And so this is the book that we're reading at the moment. It's Jesus Calling for Medical Professionals by Sarah Young. And I just pick a passage out of here, and then, oh, this is a good one. And then we read that, and then we move along. And so this one's titled, Expect Difficulties on Your Path. In me, you can discover joy inexpressible and full of glory. You will not find this kind of pleasure anywhere else. It is available only in your relationship with me. So trust me, beloved, and walk confidently along your life path. As we journey together, you will encounter many obstacles, some of which are quite painful. Expect these difficulties each day, and don't let them throw you off your course. Refuse to let adversity keep you from enjoying me. In my presence, deep sorrow can coexist with even deeper joy. Your life with me is an adventure, and there are always some dangers involved in adventurous journeys. Ask me to give you your courage so that you can face your troubles boldly. Keep your hope fully fastened on me and on a heavenly reward that awaits you. Your full joy will expand astronomically, beyond anything you could possibly imagine. When you reach your eternal home, there you'll see me face to face, and your joy will know no bounds. Whom having not seen, okay, so we have three scriptures. The first one is coming from 1 Peter chapter 8, verse 8. 1 Peter chapter 1, verse 8. Whom having not seen you love, though now you do not see him, yet believing you rejoice with inexpressible and full of glory. The second one is 2 Corinthians chapter 6, verse 10. Sorrowful, yet always rejoicing, poor, yet making many rich, having nothing, and yet possessing everything. And lastly, 1 Corinthians chapter 13, verse 12. Now we see but a poor reflection as in a mirror. Then we shall see face to face. Now I know in part. Then I shall know fully, even as I am fully known. Amen. I just had a thought at the top of my head, and I was going to talk about it because I promise you, he hasn't been making any noise all day. It's just this moment. Okay, so like our topic is nursing school is a business. So college is so first let's say that everything in our society is made up. It's all made up, right? The color blue, the fact that that's the sky. We have given these things meaning and value, and even classes to what is more important, what's more valuable. And so, even money, right? Money, people argue gender, all these things, race, all these things have been made up, and we've bought into it as a society. And so we grow up, and our parents, our society emphasizes that, oh, you must go to college and get this degree to get a job. Even if you believe that, yes, this is all made up, we don't have to buy into the system, we understand that the system exists. And so we want to set our children up for success. And so we tell all of them to grow up and go to college, whether you believe college really does the job or not. Certainly, if you're in clinical practice or in law, there are certain professions where the way we've structured our society, it's necessary. And some people would say it has created disparities in access to being able to enter those professions. So, for instance, wanting to go to nursing school, want to be a nurse. Well, in order to be a nurse, we've created these rules that say you have to have a license and you have to take an exam and be certified. All of those things require money. Everyone who participates in this system gets paid. The school, board of nursing, and the certification organizations. So, of course, it's getting promoted, it's being mandated every year or two. You have to then come back and pay more money, take more classes under because you need to stay current, right? There's many ways you can encourage people to stay current that wouldn't necessarily require money. You can just have people sign up and pass or fail, and no money would have to be involved. But that is not the world we live in. So then we go back to this whole concept of you need a license and a certification to practice. So in order to get that, you have to have a degree. And when you get the degree, you go to school. So the school is a business. So the school is like, okay, well, what do businesses do? They solve problems. They help you meet a goal. Your goal is to get a degree so that because you need that degree to get a license. So the school says, okay, we'll create this degree for you to get your license. Well, how do we attract people to our school as opposed to their school? What sets us apart? Well, in order to get that license, you have to pass the exam, you have to pass your boards. Well, what if we tell everyone that we have the best passing rate? And then they'll want to come to our school because they're going to believe that it's guaranteed they're going to get this. Um, we're giving out the degree. They'll pay for this degree. We have a high passage rate for boards. They're more likely to come here. If they believe they're going to have a high percentage of passing boards, and then they're going to be more optimistic that they're going to be able to get their license and certification, and then practice as a nurse practitioner. So all of our marketing, all of our energy is going to go into this passing rate in our brochure, on our website. When we do videos and presentations, we're going to talk about our passage rate for boards. All of our curriculum really needs to be designed so that we have the high passage rate. And so that is why when people finish nursing school or NP school, they still walk out and will say things like, oh, you're not going to learn everything in school. And even when you start practicing, you realize all the things you didn't know. So when you first come, you're looking at this video, you're looking at schools, and you're like, I'm going to go to nursing school. They're going to make me a nurse. And they're going to get me from 0 to 100. But that's actually not true. They're not going to make you a nurse. Your clinical practice, your persistence, your dedication to education, that makes you a nurse. They prepare you to get your degree, pass boards, meet the criteria to then pay and get your license. That license then makes you eligible to get a job. Showing up every day for your job is what makes you a nurse. So if you understand that nursing school is a business, then you understand that nursing school, we're talking about the school, not the individual people who are your instructors and who you love, right? We're talking about the school structure itself. You have to think of them on a systems level. Then the school doesn't care about other things like the impact on a day-to-day basis, how to build relationships, they certainly don't teach you about the cost of healthcare. Patients come in knowing more about the cost of healthcare insurance than we will ever know unless we take the time to figure that out. Contracts, negotiations, conflict, even some conflict resolution. There's a little bit of it, but not to the degree that we learn in practice. You come in practicing, you want to care for people, and then you get in and realize not everybody cares for you in return, or even though they've shown up to your setting, they really don't want to do any of the things that you said. Like, that's conflicting, right? How do you manage that and navigate that? So all of those things we don't learn in school per se. And so you have to step back and realize that it's your responsibility to then go out there and learn all these other areas that nursing school hasn't taught you, because really they don't have to. Their primary goal is that one thing, which is to help you pass boards. Just like your parents' primary goal is to help you to survive and to know the basics so that you can be independent and a participant in your community. And so when they're so busy doing that, even your partner has let's say, categories that they meet as your partner. And when they're doing all of that, when your parents are doing all of that, when your pastor is doing all of that, then they don't have time to do all the other things. And that's why community is so important. If you go to the beginning of any content I've created on the internet, I have been talking about community from the very beginning. And I think my first real experience in community would go back to church. And then the next time I was really impacted by community was going to college as a freshman. You certainly get a huge sense of community there. And then nursing school. And even now, as a practicing clinician, anytime it's almost like the military. I think I've said it multiple times here. Whether I meet a fellow nurse, or I take care of someone or meet someone who knows a nurse, immediately there's like a bond, there's a connection. There's a sense of like, oh, I just found someone in my family. And so we are part of a community, and we're here to help you. We're here to mentor you. We're here to let you know you're not alone, and to show you all the different ways you can leverage your expertise so that you don't have to feel burnt out. You don't have to feel like you're suffering in silence, and so that you can understand exactly what it is that you think you're agreeing to. And so it's so attractive. Nursing comes with a lot of respect, and you probably know a ton of nurses, right? You might even have some in your parents, your immediate family, and you've been so inspired by what they do. You want to work with your hands, and you just want to do work that's meaningful and lasting. And nursing will definitely provide that. But I think the point of this video is to show you that nursing and healthcare, they're both businesses. And so with that understanding, you have to recognize that there's responsibility that you have to take care of yourself. And like I shared last week in my 1-year anniversary video, you can't give everything. You need to have something left at the end of your day for yourself and for your loved ones. And if everyone on our team does their role, the patient will still get patient-centered care. But by holding back a little bit, by being part of community, we then just can start talking about this concept of provider-centered practice, right? What does that mean to have provider-centered practice? It still means that patient-centered care is delivered, but as a provider, I started writing about this morning, is that I hold how I care for myself, so that, and everyone's going to say, oh, so I can show up for my patient. No, so I can show up for myself. Because when I show up for myself, then yes, I can show up for my patient. I can show up for my staff. I can show up for my family. I can show up for my community and be present. And I'm going to continue to talk about that and emphasize how important that is. And you're not going to see that on your social media reels. It's not going to be in your textbook. It's not going to be on your board exam, but it's going to impact your day to day. And so understanding that nursing school is a business and that healthcare is a business. Now, as nurses and physicians, we get into the business of nursing and medicine, which is completely all about compassionate care, right? And so when we take our concept of compassionate care and put it in the healthcare industry, that is a business. And oftentimes there's some tension there, because we don't feel like the people creating these businesses are necessarily thinking about the compassion of what it means to care for people, because they're coming in from a business lens, which is all about return on investment, getting more out than you put in. And certainly when it comes to compassion and clinical practice and patient care, it's really more about putting in more than you're ever going to get back from the patient, like directly, right? They're not going to pay you, they're not going to give you benefits. But what I've realized, like I said, I celebrated my 1 year NP anniversary this week as a working NP because I've been an NP for 5 years. And just reflecting, I reflected on that big lesson that I learned about, provider-centered practice, but also this idea of anytime somebody comes on, it's like I want you guys to come on, right? But the truth is, once you come on, I completely get so distracted, which is why I haven't even because the smart thing to do would be to go on social media and say, "Look, I'm going live. Come join me on social media," right? But then when you come, then I get so distracted and I lose my train of thought. Um, and so, yeah, I'll look back at this and I'll say, "Oh, you completely should have stayed focused." Oh, that was probably my mom popping in because now she's calling. Because she always says she pops in and pops out. And now I forgot what I was saying. Hmm. Just this week, I was thinking about. It'll after I watch this, it'll come back to me, and next week I'll touch back on it. Um, I really want to remember too. I know. Well, I don't think that's what I was going to say, but back to if you understand that you're taking your compassionate care and you're putting it into the business. Oh, that's what it was. So, okay, so look, we're in the business of compassion, right? But we're in an industry that is not necessarily focused on compassion. And so that's why as clinicians, you're the one or you hear people talking about how that's missing from this business structure. Now, a couple weeks ago, I came on and talked about how, oh, like if you want to start your own med spa, right? So you're coming into healthcare solely to become a nurse practitioner to start a med spa. And I said, well, the goal of starting a business eventually is to not work in the business, but on it. So at some point, you won't even be using all of this clinical training that you've developed, all this time that you put in and the money you're investing. So if you say, oh, I'm going to go to school, maybe you're going to get done in 2 or 3 years, think about the time and money you're spending, and then you're going to start a business after that. Well, why don't you just start the business right now, right? Because the ultimate goal is you won't even be working in it. And so you'll have this degree. And yes, certainly if you're a clinician, you own a business, you can use that information. But also, most of your daily energy will be spent on running the business, taking care of your employees, getting your name out there more, like the actual running of the business. And so I was thinking about that advice because as we know in dermatology, a lot of big firms are buying out practices. And so people who have been in dermatology for a long time are really, disappointed at the change that this has taken because you have people coming in who do not have healthcare experience. Even in the hospital, we've had this for a long time, actually, where people are coming in, they're in leadership and management positions without that clinical knowledge. And so they're running it like any business. And those of us who do provide patient care feel that there's a mismatch when it comes to what are we really doing here? What's the most important piece of this? And so while we're taught about patient-centered care and that, really drives our day to day, when we go to work, we don't see that that's happening through the decisions that are made, through the resources that are available, to the staffing that's supplied. Because if we all believe this was about the patient and providing safe, compassionate care, then we would have more than enough staff. We would have up-to-date equipment. People would not be turned away because of insurance, right? If this was about compassionate care. And so, ever since I said that, gave that advice, I've been thinking about how to the responsibility of that. If you're going to start a business and you're not going to have clinical practice, any clinical experience, then you have to think, how can you still provide that compassion? Because we have clinicians, we have NPs who are, leaving corporate to really start their own business and provide the care that they really, that we all believe is um, what patients deserve, right? And so that equates to longer visits, um, making it more accessible, making it more affordable, focusing on treatments that actually provide cures and treatments. And so you hear a lot of this if you're listening to other podcasts and networking. You're going to hear this a lot from people who have been practicing. Primarily, those are who've been practicing already for a while. Because if you're new, sometimes you're more focused on the conventional model of nursing and medicine, but once you've been in there and you kind of get a look at what's really being offered, you kind of tend to want to go a different direction. Um, and so, yeah, if you are going to start a business and you're not going to have that clinical experience, then my advice would be to get people who have it and to have them be decision makers, so that they can really guide that business. Because I think the two can exist where you provide compassionate care, patient centered care, accessible care, and still have a thriving, successful business. And that can only happen when the two come together, those who know all about business and those who know all about the patient. But too often we're working in separately and then trying to make it all work without speaking each other's language. So that's the business side of nursing that I wanted to really talk about. And so for you students, I just can't emphasize enough the importance of being in community. That community, doesn't have to even be other clinicians, although it is important that you have community outside of wherever you work. Um, and not just rely on your employer to give you everything you need. They can't. They're running a business and they might still be seeing patients. When they do all those things and do all the things we talk about in the beginning of the video or in the agenda of taking care of themselves, taking care of their family, their mental health, spiritual, financial, um, physical, mental, spiritual, financial, emotional. If they're doing all those things and running a business and taking care of their patients, they literally can't give you everything. And I've seen you all in the, on the internet and different platforms saying you want to get a job and they can teach you everything you need to know. That's not realistic. And coming into nursing school and NP school thinking they're going to teach you everything you need to know, also not realistic. And so you need to be part of community so that people can teach you and show you the ropes, give you some guidance on how you can expand your knowledge and your understanding and create a life that works for you, right? So that's all I have to say about that. Um, and so when it comes to community, there's so many ways you can be part of one. You can create your own and you can join some that are already out here. And so let's get into our normal agenda. Since we're talking about community, let's just talk about the DMV Dermatology NP group, which is a networking group for NPs and PAs in DC, Maryland, and Virginia who practice or aspire to practice in medical, surgical, and cosmetic dermatology. And we have our new sister group, Derm NPs and PAs of Atlanta. Shout out to Caleb, Derek, and Allie. Allie is your new advisor down there in Atlanta. Caleb's out there in Blacksburg, and we have Derek in Richmond. They'll be starting their meet and greets real soon as their MSL comes off of maternity leave this month. And then Allie's out there, fresh new group. She just started an Instagram page. The link to the Facebook and Instagram page are below. For Facebook page for both groups, you do have to answer all the questions. That includes providing your medical license and proof of student enrollment. That's just to maintain integrity of the group, right? So that people feel like they have a safe space. And the link is also there in case you don't want to be on Facebook, because a lot of clinicians are not on Facebook. And that's not a requirement. And so we have a link there now that you can sign up for all of our events. And you can also, and so including our Friendsgiving on Thursday, November 21st in Old Town at 7 p.m. With our speaker, Shana Moranti, who's a dermatology physician associate out there in Naples, Florida. She's going to come, and also a fellow diversity and dermatology leader. She's been in clinical practice for over 20 years, and she speaks all the time. She's going to come up and be our speaker for Friendsgiving. You can sign up for our virtual grand rounds, which start in January. And so the virtual grand rounds will be, I have met with Caleb this week to start planning for that. And so, yeah, we're going to have case studies for you. We're going to talk through them, give you a chance to build your differential, learn about the latest treatment options, what it says in research. So, all your clinical stuff from presentation to diagnosis, evaluation, documentation, productivity, all those things. But also, we want to keep you abreast of upcoming events. Um, and what's going on in social media and in research because you're so busy during the day taking care of your patients that you can't stay abreast of everything, right? And so our patients, they stay abreast. They know sometimes a lot more than we do about current events. And so we just want you to be able to, when your patient comes to you and talks about something they see in social media or read on the internet, or even read articles. I have families who read peer-reviewed articles, and so to be able to have those conversations with them, engage with them, let them see that you are up to date, that you're willing to engage in the conversation, and to be able to give you the information so you can feel confident about that conversation, but also like a way to be productive with those conversations because you do have other patients to see and other commitments to keep. And so um, there is an art to being attentive when patients bring up concerns and also maintaining a schedule, right? Without the patient feeling like they're just a number that you're trying to get through the day. That's very, very important when we talk about patient satisfaction and keeping your clientele. So if we're having a business, that's a really important piece too. Um, so yeah, and so we'll have little pieces of that each rounds so that you can just be abreast and know what's going on, and then not keep you too long. They'll be about an hour long. They'll be free, and we're going to save the recordings. And so if you're not able to attend the live session, then you can watch it. We're planning to save it on Facebook. We'll have to see. We might have to do some test runs to see how that works out, or find another platform to save the videos. But we're super excited about it. I'm really happy to be partnering with him. And yeah, it's just going to help. The idea is that it helps all of us really, because there's over like I think I've read both that there's more than there's 3 and 4,000 diagnoses in dermatology, and when you're trying to see patients during the day, come home and take care of your family at night, and then try to study all of this information, it's a lot, right? We know dermatologists have a 3-year residency. Some will can go on to fellowship and get additional training, and of course, they're still learning. And so, because we're coming from such a deficit when it comes to dermatology and our nursing education, we have a lot of catching up to do. But I know we can do it, right? I want to see us have a strong presence in dermatology, and a voice when it comes to improving patient outcomes and this access to care. That's like the primary reason our profession was created. And there is a huge wait for patients to be seen by a provider. And of course, we want to have more a diverse provider population, not just diverse in terms of race and gender, but also in terms of professional roles, NPs, PAs. And I think that's really important. And so um, we want to be here to support you as you navigate this terrain, um, having not known what to do in nursing, having not been taught what to do during nursing school. So yeah, so that's what we'll cover in those hours, and we'll do one a month. So we have 12 already planned out for you all, and so we'll start working on those, and you can sign up for that below. Um, for Blacksburg, Richmond, and Atlanta, we need all the help we can get to help get our message out there, let people know we exist, so we can get more people coming on board. So when we have events, they can join. In-person events are limited to students. So we already have one signed up. Actually, they haven't signed up yet for the Friendsgiving. Um, they inquired, but they didn't sign up yet. So it is a first come, first served basis, and then we'll start a wait list. But the virtual grand rounds will be open to everybody, and it's really important that you come willing to work. When I used to do tutoring sessions, nobody sat down. everybody was up at the whiteboard and everyone's talking and teaching. And that's the best way to learn, is to put things in your own language, to not be afraid to say the wrong thing, because that's when you create memories, that's when you create new wrinkles in your brain, and that's when you start to get retention. And so when you have new information the first time you see it, you review it within 24 hours, you can increase your retention by 75%. When you put yourself in a teaching position, your retention increases tremendously. So me and Caleb being able to put these together, that's going to help us a lot. But we want to give you the opportunity also to take that on, maybe not even a whole hour, maybe just one of the case studies, just so that you can also have that opportunity to start learning and growing and actively participating in our practice. And so when you do apply for that job, when you do update your resume, you can say, these are the things I've been doing. It's showing your commitment. And also for yourself to say, is this really what I want to do? Is this what I thought it was? Because whatever you're after, trying to get your first derm job, every day someone new's coming in interested, trying to figure out how to get in. And at the same time, somebody's asking how to get out. And you really need to be, and that's why the community comes back to being so important. Talk to these people before you make investments in your time or your money, even your emotions, right? To find out what the pain points were for them. How did they make it work? I was talking to someone who was thinking about being a CRNA, and I was like, I could never do it. The hours are unpredictable, right? And she was like, I could never be a night nurse, you know? And a lot of people say it interrupts their sleep and their social life. And so it's important to figure out, and I didn't think I could do it either, right? But it worked for me. And so it's important when you talk to people, like, how do you work around those pain points? How does it work for you? Because it might work for you too. So that's enough about that. Um, so that's our community there. And then Diversity in Dermatology, we have our conference coming up March 27th to the 30th in Louisville, Kentucky. We'll be staying at the Louisville Marriott downtown. 4 days of really cutting edge lectures with our esteemed dermatologists. In the evenings, we have receptions. One will be at the Churchill Downs, so you must come decked out in your attire. And then we have our Achieve program, which is our 12-month online didactic program for NPs and PAs in their first 3 years of dermatology, so that you can build your medical derm foundation. You get access to a textbook, online and on-demand resources, modules, as well as live sessions with our dermatologists as our faculty. And that alternates with our NPPA mentors to offer you that additional support and community. That's so important. Registration is open. The agenda is live. You can go and check it out. Putting together kind of some blocks for you, right? And so hopefully you find that to be that it works for you, that you like the idea of like thinking about one thing at a time. Alopecia, personal what is it, hair loss, personal development, in these like segments. And I like it. I like the theme of that. Really fun conference. We offer a unique boutique experience for you. It's a really wonderful setting where you can network, meet new people, see old friends. And of course, it's in Louisville, which is, I love the Midwest, and I think you'll love it too. And it's going to be a really exciting opportunity if you've never been to the Downs. And then DMPs of Color, right as I'm filming this, I just got off of from interviewing Dr. Danielle McCamey, the CEO, president, and founder of DMPs of Color, and a good dear friend of mine. She is preparing for the organization, preparing for our 4th annual conference. This one's in person. It's at Pittsburgh. I mean, not Pittsburgh, in Philadelphia. And it coincides with DMP Day and DMP Week. Shout out to them. DMPs of Color is the only organization dedicated to DMPs and promoting doctorally prepared graduate education amongst nurses. You don't have to be a DMP to sit with me. We have membership for everyone, whether you're in nursing or not, whether you have a DMP or not. We have opportunities for everyone, and we welcome everyone to sit at our table. So she'll be on the Melanin Initiative this Sunday, talking all about what to expect at the conference. Of course, her motivation and for starting DMPs of Color and the mission of the organization. So that's exciting. And then this past week, we dropped an episode on the Melanin Initiative about medical cannabis with Ashley Wynn Grimes. And since that show aired, we've since heard from an organization that was really inspired by that episode. They extended an invitation to Ashley to come on their radio show. The Haitian American Nurses Association of Hudson Valley, New York. They have a community health and wellness radio show to grow community awareness of disease processes and illness prevention, encourage health promotion activities, and increase health literacy in the community. And they invited her on to talk about medical versus recreational cannabis, the stigma and uses for various health issues. It's a bilingual show. It's done in English and Haitian Creole. It runs from 6 to 8 p.m. on Wednesdays on Groove FM radio. And she'll be interviewed in English. And then they'll do a summary in Haitian Creole. And so they've already picked a date, which will be oh, there it is. And they're going to talk for 90 minutes. Oh, the 23rd. Okay, so October 23rd from 6 to 8 p.m. on Groove Radio. So make sure you tune into that. We've offered to help with marketing, and so once they send that, if and when they send that over, we'll share. That'll be over there. You can follow the podcast on every platform, whether that's YouTube, LinkedIn, Instagram. We'll be able to go live on Facebook once we hit 100 followers over there. And then, of course, on all your favorite podcast apps. For us, Apple happens to be our most used platform where people listen the most. And so new video episodes drop Sundays at noon Eastern, and all our audio drops at 5 a.m. So our night shifters can be the first to get something and not the last. Link below for the virtual Preceptor shop. So I dropped two things recently. So first is the Bedside Dermatology. Oh, you know what? I think somebody bought that. This week. I've been trying to do a good job of little entrepreneurship talk for you, of sending out thank you letters and asking people to leave reviews. You have to do those things if you're thinking about. You have to get used to asking people, whether it's for help or even asking for reviews is really a help, and giving them the explaining why that's important. And so I think somebody bought a book today or yesterday. So yeah, we have the From Bedside to Dermatology, a step-by-step guide for nurses helping you get in. We have our Dermatology Nurse Practitioner Starter Kit. It is a starter kit, and in both books, the starter kit, I think that's more than 20 pages, and the Bedside to Dermatology, that's more than 70 pages. It breaks down how to create a CV, how to set up your LinkedIn profile, gives you script for messaging people when you want to shadow, real live job announcements so you can see what requirements they're going to be expecting. So if you're still in school or you're still in a clinical setting where you can obtain these the experiences and the requirements, so that when you finally apply, you'll actually be a really competitive candidate. That's my whole goal, is to help you be a competitive candidate. And so pretty much everything I'm creating is for that purpose in particular, so that you can do what I wasn't able to do, which is get your first job in dermatology as a nurse practitioner, because you're not going to necessarily meet the requirements coming straight out of nursing school. Some people will get jobs without any experience, but a large percent will not. And so it will require you to take these extra steps. And so I created the virtual preceptor shop, and it has digital resources in there to help you do just that. Let's see. And so also in honor of my anniversary, and because of your questions, like I mentioned previously online, the virtual preceptor shop has become my answer to your questions. And so I recently got a question about acne and hyperpigmentation. And so I released the Mahogany Telederm recommend skincare over the counter recommendations, over the counter skincare guide um, to treat your acne, hyperpigmentation, and aging. Even I don't know. I'm creating so much. Oh, I didn't even put it in there. So yeah, that's a new addition to the virtual preceptor shop, and I'm eager to hear your feedback. And I'm eager to see her pictures because I told her, like I tell everyone, to make sure you take pictures and track your journey. Um, and it's called the Your Mahogany Telederm over-the-counter skincare routine. And so yeah, my whole journey with dermatology started with acne, treating my partner's acne, and we used over the counter regimen that worked for him. And he continues to use it, and his skin looks really, really good. And we did start eventually doing some microneedling, and so the two go hand in hand. You have to have a good skin barrier that starts with having a consistent regimen that you can follow, and then being open to cosmetic treatments, which can treat some of the more harder to treat side effects of acne. And so we really want to encourage a good skin regimen, but also to take acne seriously and try to be aggressive when you're seeking treatment so that you can avoid things like scarring and hyperpigmentation, which can become really deep and take a long time to heal. And of course, it's more expensive as well. And so the best practice is always going to be prevention and primary care. And that starts with sunscreen. My favorite's coats at the moment. I've been wearing it for I don't even know how many years now. Oh, you know what? Because I used to just use Pipette and it worked fine. It did have a little bit of a white cast, but it had a great glow. And then I came across this one because my love bug had mentioned that they didn't like the other one. Because you know what? That other one with lighting and pictures, the white cast became a little bit more prominent. Some of my old pictures and videos, you can see it. So then I went out looking for another option, came across Coats, which stands for contains only titanium and zinc oxide, which are important ingredients when we start talking about protection from visible light. And that is important when you start talking about skin of color and protecting our skin from light. Not don't focus on just the sun because the sun is not necessarily the main thing you should be concerned about because visible light is also a threat to the skin. And so if you use sunscreens that are tinted, it will usually meet all the requirements, which are or the recommendations for skin of color, which are broad spectrum, SPF 40 or above, and of course, mineral. Really love minerals. There are a lot of good ones out there now that don't have a white cast. But the most important thing is that you find one that you like and that you wear it, every day, all year long, indoor, outdoor. You apply every 2 hours, more often if you're swimming or sweating. And don't forget your body. And so, yeah, those are the additions to the virtual preceptor shop. And the Mahogany Telederm Nurse Internship application is open. It's live until December 15th. And this is an opportunity for you to learn about the peer review process, to help me put out more articles, to get your chance to be listed as an author, to help work on presentations, to give presentations if you want to do that and start practicing, building your CV and your skills and your confidence. And then in exchange, I'll just teach you everything I know about social media, branding, building a telehealth practice, um, marketing, and your reputation. And so, I love partnership. I talk about it all the time. And this is a chance to do that. More importantly, it's a chance for me to develop a framework. When we look at our physician colleagues, that despite the rigor of med school, for instance, they still will publish, participate in research, take on leadership positions in organizations, volunteer, be active in the community, and still have really good grades and pass. And yet for some, and have mentorship. And yet for some reason in nursing, time continues to be a huge barrier for nurses to show up for meetings, be active in organizations to take on leadership roles or mentorship roles, and even knowing they exist, still being really hesitant to take them on. And maybe it's because it's not mandatory, right? Maybe it's because it's not, I just think it's because of the culture, right? And so if we change the culture, then I think it will help elevate our practice, our confidence, our standing in the community, not standing in terms of respect, but standing in terms of what people understand it is that we do and why we exist and how we contribute to their care. And I think that in order to elicit those changes, then nurses have to have involvement in publication policy and curriculum. And that developing those skills and confidence really kind of starts with mentorship and being part of community so you can learn what it is I'm talking about, and have the guidance to continue to learn about it. And lastly, let's go into these labs, right? So these labs are going to be comparison between December 22 and September 24, 2024. And so, like I said, I was supposed, wait, 2022. Oh, so yeah, so 20, so the thing is when it's a December, so that's basically like January 23rd. And so I was supposed to see her this January, but I was in the beginning of just getting off orientation and being on my own and trying to figure everything out. And so like I talked about last week, I finally made my appointment last week. And so I'll talk about my results because I've been plant-based since 2017. And it's a really popular question that people have in terms of like protein and nutrients and what do you eat and stuff like that. And so why not just talk about the labs and you can um, make your own conclusions. And I love, even when I'm getting clinical information, I always want to know two sets of data points, right? Because you want to understand the trend. If I just say something is a 5, but I don't know what it used to be, then that 5 really doesn't have the same value. Um, and so we'll do the comparison. So let's do sodium. So let's do the old number, then we'll do the one that it is now. So last time it was 138, this time it was 140, so pretty much the same. And I would say overall, my numbers are actually pretty much the same, which made me so happy. Um, as I mentioned last week, I get a lot of anxiety when it comes to my primary care appointments, because I have so many risk factors. And so I just freak out about having any of these diseases. And yeah, I just get a lot of anxiety about it. And so my potassium, pretty much the same. It was 4.1, now it's 4.6. Random glucose was 79. This time it was 75. And this appointment was at 12:30 in the afternoon, and I was fasting that day. My creatinine was 0.83, and this time it was 0.82. Total protein was 7.7, and this time it was 6.5. Albumin was 4.8, and this time it was 4.1. Cholesterol was 167, and I have to say that was because I was eating a lot of almond butter. And I do eat quite a bit of nuts and seeds. But I mean, what I fell in love with, my mom had introduced me to Justin's vanilla almond butter like a couple years back. Oh my God, I fell in love with that stuff. I was eating it a lot. Probably, I'm not even gonna tell you how many in a month. But now I might go months without, I'm eating the same from the same jar. Whereas before, I definitely bought more than one a month in the past, but I've gotten a lot better. So it went from 167 to 137, which I'm so happy. My triglycerides is 52, both 52, 52, no change. HDLs, it was 77. It's down to 60. 60 is still within normal limits, but I really like for it to be higher. It's protective cardiovascularly. And so I really think that's probably related to my exercise, how active I used to be working, at the bedside 12 hours because I used to keep track of my steps. I used to get anywhere from 15,000 to 20,000 steps a shift. And then in the last few years, I was also either walking or biking to work. And then I still had my workouts. So I didn't even count those as workouts. And I still had my regular workout. And so I was really, really active then. I still live an active life, but it was embedded into my day to day. Because even now I do stand quite a bit, but it's not steps. Like when I count my steps at the end of the day, it's only like a thousand, maybe 2,000. And some of that's because I'm walking the dog. So drastic difference in like physical activity. LDLs went down quite a bit though, from 80 to 67. My A1C, not too much change, 5.4 to 5.5. And it's been like that for even before, like the last before set before that. And some of that is from the plant-based diet, certainly eating a lot of beans. I eat a lot of fruit. And I find that you can eat a lot of fruit, but if you eat a lot of fruit and a lot of processed carbs, it will significantly increase your A1C. I know a lot of people will say, "Oh, you shouldn't eat that much fruit," but remember, it digests much differently, and I don't eat a lot of high glycemic index fruits, and so that's part of it. I know when I first went plant-based, I ate a lot of chickpeas, and my number was up a little bit. It was up a little bit. And so then I started paying more attention to the carbohydrate number for chickpeas versus other beans. And chickpeas are one of the highest concentrated carbohydrates. I want to say black beans are a little bit on the lower side. I don't remember what lentils were, but I just kind of cut them down. And that has pretty much allowed me to stay pretty consistent. Iron was 192, and this time it was 109. Thyroid stimulating hormone went from 0.859 to 0.993, so not much change. B12 was 620 down to 525. I used to take a B12 supplement, and I'm sure there's more experts than me, but from what I read, there was really no general consensus on how much to take. A lot of it was just like, I want to say 2.5 milligrams a week. And so I used to take it just I think I might have used to take it once a week. And then when you listen to people in the plant-based community, they really stress about it a lot, especially if they're new. That's a big part of the conversation. For those who have been doing it for a while, it doesn't come up as often. But really, the only way to know is to test your blood, because some people will talk about different foods you can eat, like nutritional yeast has a pretty high concentration, but I don't know that it meets the nutritional value that you need for cognitive health. But my numbers are consistent. And then vitamin D, oh, it went from 90 to 69. And I don't know if that's right. If it was really 90 before. And then, I mean, that's still within normal limits, but yeah, that was high. Maybe I was spending more time outside. I don't know where that's got. Or eating something that was fortified with vitamin D. I do take vitamin D though regularly. And then my white blood cell count, it's been like this for a while. It went from 3.2 to 3.1. And then my H&H was 13 it went from 16 and 49. So last time it was a little bit hemo concentrated, a lot. And this time it's 13 and 42, which is pretty good. I think in the beginning, it was a little bit more on the anemic side, but I've been able to maintain, and I'm really not that great about taking my iron, to be honest. I usually try to remember, because of what I eat, I try to, which is like beans. When I first went plant-based, I used to cook a lot with my cast iron, which I still have. I actually use a lot of cast iron. Because I always try to eat more red meat and liver and stuff like that, which I did in the beginning. No, not in the beginning. When I used to give a lot of blood and I was always anemic. Funny, I used to struggle more with anemia when I was a meat eater. And so I would go give blood a lot, and every other time I would go, they would say I was anemic. So I would go home, eat a lot of liver, cook on the cast iron, go back, it would be fine. I'd give blood. Once I went vegan, then I still use the cast iron, and just a lot of the foods are just high in iron. And if you combine it with vitamin C, you get better absorption. And so just knowing like little things like that, um, it's not like something I think about anymore. It's like once you start eating that way and understanding how to combine foods properly, you're not thinking about it anymore. You just do it. But really, if you just have a diet that has a lot of variety, you're probably going to hit your mark. So it's not something I really stress about. The main things I follow and monitor are my sodium intake. Uh, and yeah, I guess I just know which foods to eat and how often to eat them. So that's probably part of it too. And so, yeah, I don't share those numbers because I think you need to know my numbers. I share them. I hope it inspires you to, if you haven't, to get your blood work and to know the meaning of each one and how it, how it's supporting your goals for your lifestyle. So that's all I have. I really thank you for joining me at a different time. The plan, hopefully, the following Sunday, I should be able to resume our 3 p.m. Time slot. So the 20th, which coincides with National DNP Week, which, by the way, we might be doing some more things for on the podcast. So stay tuned for that. Everything we talked about today is in the description box. Thank you so much for watching. I hope you have a wonderful weekend. And if there's anything I can do to support you in your journey, please don't hesitate to ask. The best way to contact me is on the Mahogany Dermatology blog. And if you're not a nurse or a nurse practitioner, you're not into dermatology, but you know someone who might be, your child, your student, your mentee, your neighbor, your colleague, someone at your church, please share my resources with them, and tell them to reach out to me. Let me know how I can best support them. I thank you so much for watching. I'll see you next time.